Melanoma is a pretty big killer here in New Zealand. In fact, it's our fourth most common cancer. It's the cancer most likely to kill people under the age of 40. So how do we stay safe? Well, apart from the obvious, covering up, which I need to do in the sun right now, early detection's the key. So I'm here at MoleMap to pick up a new piece of technology that I can take on a mission to one of New Zealand's hotspots of melanoma, Nelson Marlborough. Tell me kind of how it works, Kim.
Well, the reason it works so well, Tom, is because it's nice and easy to use. Only 3 buttons and 2 modes. One is a clinical mode, which allows the dermatologist to see what he would if he was here in person. And the other is the macro mode, which allows the dermatologist to look slightly deeper beneath the skin and look at the surface patterns and structures.
Excellent. So I'm going to be in remote places like D'Urville Island, and I can make a bit of a diagnosis myself, but I know I've got the backup of trained dermatologists that can look at the images and give us a bit of a heads up whether it's melanoma or not. I think one of the other great things about this is, as a GP, people come and see me all the time and say, has my mole changed? Now, if you've got 20 or 30 moles, sometimes it's hard to remember people's name, let alone what their moles look like. This has got to be good for that sequential photography of people's lesions, don't you think?
Yes, MoleMap's really great at sequential monitoring, and that's why we encourage people to come back not just the first time but come back again for a follow-up, and we always store their images in a secure way so that we can look at them next time when they come in and really compare if there's been any change from the last time they visited us.
That's such an important point, because one of the things of this deadly disease of melanoma is it creeps along the edges and then it starts to burrow down and get into your bloodstream, right? So what we want to do is look for change in the shape, the size and the colour of the mole. So this tool allows us to do that, and dermatologists actually track what's happening on our skin, and it may save your life.
Yep, that's right.
Thanks, Kim. I can't wait to get stuck into it.
Good luck.
Cheers. Well, that's pretty cool. Been into MoleMap. Got my new tool to help fight melanoma. So we're taking this jet ski from the west coast of the South Island around Farewell Spit into Golden Bay. Then we're going through Abel Tasman National Park, running some clinics on D'Urville Island, then heading to Picton. So it's great I've got a waterproof camera, because then we're going to cross Cook Strait and head into Wellington. So I hope it's smooth sailing. Hi, well, Dr. Tom on a mission. We've made it to French Pass. We're off to D'Urville Island looking for melanoma. With me is Jeremy Burfoot, organiser of Ski NZ 2014. Jeremy, amazing job. Tell us how far we've come and how far we've got to go.
Yeah, Tom, we've come from Farewell Spit, and we've been through the Abel Tasman Park down to Nelson, and now we're up here in French Pass. We're going from here around D'Urville Island today, and then into Picton the following day, and then if the cyclone allows, across Cook Strait on Saturday.
There's a serious side to this, isn't there? I mean, you yourself have had melanoma. Is that your motivation for doing this?
That's right. I had a melanoma in 2005, and I was lucky to catch it early. And 300 people around about every year die of melanoma in New Zealand, and 90% of them didn't have to if they caught it early like I did. So that's the primary thing we're trying to achieve here is some awareness.
Yeah, well, exactly. Working in the emergency department as I do, I see people coming in that have seizures, and we scan their brains and they've had melanoma. Well, they've got it in their brain, and it's a pretty hard thing to fix when it's got that far. And as you say, 90% of it is preventable if you go and get it sorted, get a mole map or get it cut out. So what about yours though? You had a bit of it's not an uncommon story what happened with your melanoma. It tried to be frozen off or something, didn't it?
That's right. I went to my GP, and he had a look at it and went, oh, I'll get rid of that, and he tried to burn it off. Yeah. And all that did was make it angrier, and about a month later it was back again. And that's why I recommend going to a skin specialist. Tell your GP, just send me to a skin specialist if you've got the least bit of worry,
Yeah, I think that's an important message to people. If you worry, get it cut out, because really the only way to diagnose melanoma is under a microscope. Yeah. We can have a good look with some screening tools, but under the microscope, if you're worried, get the thing off, and then you've got some peace of mind. All right, well thanks Jeremy, you've done a marvellous job, and it's a privilege to hang out with you and the crew that you've organised. And from here we're going to launch from French Pass. I'm going over on the jet ski. We've arranged to meet some of the locals through the Bush Telegraph, and I'll get my camera out and see if we can find some melanoma or raise some awareness of it. It's been a bit of a lifelong dream of mine. I've been to many places in New Zealand, but I've never been to D'Urville Island, so it's great to be here. The rest of the riders have gone round D'Urville for the day, but it's time for us to do some work. I've got my mole map camera ready to go. We've sent it out through the Bush Telegraph. We're going to be here running a skin clinic, so let's see if we can find some locals and take some pictures of some skin lesions and see if we can find some melanoma, or at least raise some awareness about skin cancer. We've got a queue of 3 people and Squid the dog turning up for a melanoma check. There's 17 families living on the island, is that right?
That's correct.
Okay, so you don't get adopted the island much?
Well, we don't. Never.
No. Never? Never. We're the first. Okay, so Dr. Tom on a mission's here, and we're going to be having a look for some skin cancers and see what we can find, because you must be exposed to the sun a lot.
We are.
Yeah.
Definitely. Yeah.
Alright, well let's get into it. Okay, well this is D'Urville Island clinic style. We're in a boat shed straight off the ferry, and this is Craig who drives the ferry. G'day Craig. Anything you worried about?
Nothing I can think of, but I just always meant to have a bit of a check.
Have a skin check. So yeah, rather than getting to town, we're coming to you.
Yeah, that's right.
That's handy, isn't it?
Quite convenient really.
Okay, well, everything looks pretty good, but there's maybe one here. That's probably what I call a seborrheic keratosis, but I'll take a picture of it, and then we'll send it to our dermatologists in Auckland, and they'll have a look and let me know what they think. Okay, well with me Susanna, and you look like you're fine sort of Anglo-Saxon stock, you know, with the
English mother.
English mother, which the English rose, and that's, you know, really prone to that sun damage.
Yes.
So look, we've found a couple of spots. Were you worried about them?
Yes, you are, because you don't know whether they're going to turn into cancer or what it is, or it is a bit worrying at times. Yeah. Especially with my sort of skin too.
Sure.
Yeah.
Well, there's 3 types of skin cancer. There's melanoma, which is the real nasty one. But there's also basal cell carcinoma and squamous cell carcinoma. Now, they're a bit like rust, and they can be a little bit painful, and they'll grow bigger and bigger. The squamous can break off and spread. The basal cell, we call it a rodent ulcer. So listen, we've taken a couple of pictures, and you know, I'm definitely sure they're not melanoma, but we're going to send them off to our skin specialist. They may be precancerous, squamous or basal cell that may need, you know, as I say, if they were on my leg, I'd probably want them cut out, you know, because they're just going to get bigger and bigger, and you know, so it's just better to get them checked. So we'll be ringing you or emailing you once I show it to Dr. Gray up north, who's the dermatologist and the expert. He may say, Dr. Tom, you don't need to worry, but at least then you get some peace of mind.
Yeah, no, it's really good, thank you.
Just come out of Tory Channel into Cook Strait. We're supposed to jet ski across Cook Strait today, but as you can see, she's pretty rough. It's gusting 40 knots. Cyclone Lucy's on its way. We've had 6 great days of calm weather, but there's no way we'd want to be able to jet ski in this. We've raised over $80,000 to date for melanoma research. I don't think there's much chance of sunburn today, but it's time to go inside for a coffee. It's no time for standing out here in this wind, and it's only going to get worse.